try to do this upside down. Should be able to do it. I probably won't use this. What I can specifically say on this, which is just a magnification of one renal pyramid, so it's a magnification of this, including this area up here. So all up here, these little pale yellow colored balls are all glomerular capsules is what they are, with a glomerulus in the center of it. But what I like to ask about this specific model is, here is a cortical nephron. It starts all the way up here at the top. Its loop is here. This whole thing is a cortical nephron. This is a juxtamedullary nephron. So if I put a piece of tape on this thing and I say, name the specific type of this functional unit, I want you to say cortical nephron. Does that make sense? And if I put a piece of tape on this whole thing and I say, name the specific type of this functional unit, I want you to say juxtamedullary nephron. Now, in addition to those two distinctions, I could ask a few other questions. And I'm just going to name some of the structures. This is a collecting duct. If I look carefully at this nephron, this cortical nephron, this would be the proximal convoluted tubule because it's the piece that's connected to the capsule. So this is the PCT here. This is the I usually don't ask descending limb, ascending limb, I don't get that specific, but this is the loop. And then this is the distal, this is the top of the ascending limb becoming the distal convoluted tubule entering the collecting duct. So that's the whole structure of a nephron that you've gone over several times. I'm not going to ask using this model, but I can even say between my fingers, that's the juxtaglomerular complex, where the far piece of the tube comes back and talks to the afferent arteriole. That's what this is. This is a blow-up of this section right here. I'm going to ask questions using this, okay? These are the questions that I like to ask on here. I'll start at the basics, with the basics. This whole thing that I'm grabbing with my hand is the glomerulus. All of these tubes right here are the glomeruli. Just the white part, or the off-white part, are podocytes. So if I say, name this entire structure, glomerulus. List a function that occurs there, filtration. Name the specific cell type, I want podocyte. Everybody okay? Now I'll just talk about the capsule. I usually don't ask the whole, like, what is the name of this whole structure, but I'm just telling you this is the glomerular capsule. Sometimes what I do ask, name the specific cell type of the capsule. Here, these are simple squamous epithelial cells. You can tell because they're flat. Name these cell types down here in the proximal convoluted tubule. These are simple cuboidal cells because they look like squares. They look like cubes. I like to ask about this. This is the afferent arteriole. This is the efferent arteriole. This that I'm putting my hand over right here. So I would take a piece of tape and strap it over both of these. And I would say, name this structure. That would be the juxtaglomerular complex. The last specific questions about the juxtaglomerular complex that I like to ask, name these specific cells, these green ones. They're macula densa cells. And their function is they monitor sodium chloride concentration. These specific cells in the afferent arteriole are granular cells. And for a function, I know you have a short space to write on this test, very short space in which you can write an answer. You could just write regulates afferent arteriole diameter. These two cell types communicate with each other, and based on what's in here, the result is this dilates or constricts to regulate